So today we're talking about sarcoids in horses, which are a form of skin cancer, and they're the most common type of tumour that we see in horses. They are locally invasive, so although they can be pretty aggressive across the skin, they do not spread internally. And in the UK, it's thought that around 2 to 8% of the equine population are affected by them. There are 4 main types of sarcoid. There's the occult, which is a flat lesion. There's the verrucous, which is more wart-like lesion. The nodular sarcoid and the fibroblastic sarcoids, which are often the most aggressive type. They are often nodular and ulcerated in appearance, and you can get a mix of these types of sarcoid occurring in the same horse. They are visually characteristic. Most horses can be diagnosed with sarcoids just from their appearance and their characteristic location. We most commonly see sarcoids on horses in the most sparsely haired areas, so the groin and around the face. It's also worth noting that some cases of sarcoid are atypical, and these are the ones that are most likely to need a biopsy. For example, some cases of wounds which are not healing are actually because there is sarcoid tissue at the site of the wound, preventing the wound from healing further. Any trauma or irritation to the site of a sarcoid can make that sarcoid more aggressive, and horses which have had sarcoid diagnosed previously are always going to be more prone to developing further sarcoids, and there is thought to be a genetic predisposition to those horses which develop sarcoids. Once diagnosed, then treatment will be targeted to the horse and the specific lesions that horse has, and treatment choices might be affected by the temperament of the horse, the use and the age of the horse, and also the owner's financial situation. Most common treatment that we use for sarcoids would involve topical chemotherapy and laser excision of the lesions. Long-term management would also include things like fly control, because flies can seed the damaged or the abnormal tissue to other sites on the same horse, or potentially on other horses in the same area. So that can be a risk in horses with these lesions.